We're announcing today that we are reintroducing this legislation, tailored, renamed, and focused to make sure that the wishes of families are observed, that people get the personalized care that they want, and to make sure that we are making it easy for the medical professionals not to be involved with some sort of default position, speculating, questioning, but making sure that they get what they want.
You know, at the very heart of what we do is to provide compassionate care to all people. As physicians, we have an obligation, really, to have discussions in advance about what people will want when certain kinds of crises hit and what kinds of health care they do or do not want.
Dad was diagnosed with prostate cancer in the year 2000, and that's when the conversations really began in our family. During the years between his diagnosis and his passing, Dad had many, many discussions with Mom and Dr. Rodriguez and our four kids about short and long-term cancer care. Dad knew what he wanted. Like Dr. Rodriguez said, he had strong opinions, and he knew what he did not want. And it was extremely important to him to have his voice heard, and thankfully it was. His final days were at home, surrounded by his family and close to his beloved blue chair. Knowing and honoring Dad's wishes just brought enormous comfort and peace to not only him, but also, I think, to all members of our family. And yet this journey could have been quite different. I think without the many candid, respectful conversations he had about end-of-life care with Dr. Rodriguez and with our family, he may not have experienced the dignity and peace that he did in his final days. He was at home, he was surrounded by his family, and it was just exactly what he wanted. It was a great gift for all of us.
AARP has about 500,000 members here in Oregon and nearly 40 million members nationwide. This is something that we've been working on for a long time, trying to educate members and the public about the need for long-term care conversations and the kind of support that you may want in the last stages of your life. We know these conversations are very important, but we also know how incredibly difficult they are. That's one of the reasons why the Personalize Your Care Act would really make a difference, because it would provide some funding for Medicare and Medicaid to have voluntary discussions of advanced planning between the patient or family members and their healthcare provider, whether it be a physician, nurse practitioner, or a physician assistant. The bill would also authorize grants to establish statewide programs for POLST programs, which we've had in Oregon for a number of years, physician orders for life-sustaining treatment.
We've heard these wonderful anecdotes and stories from today from the people that are here, but if we actually look at the published medical literature, there's some things that are really important that we also know. We know that in cancer patients who have end-of-life care planning, they are far less likely to die in an ICU setting. When we measure their quality of life in terms of their symptom control, their ability to communicate with their families, it is far enhanced when they've had advanced care planning. We've heard that from the stories today. We also know from that study that their patients' family members and caregivers have a reduction in depression after the death of their loved one by about 2/3. So there's a substantial reduction in the depression rate of their family members that survive. And then a more recent study in the New England Journal of Medicine also demonstrates for those patients who want a more aggressive approach or a more aggressive care plan at the end of their life, they're more likely to receive those more aggressive services because they've stated those preferences. So this bill is really all about honoring and respecting and understanding the wishes of the patients and their families.
This is all about choice for families, individuals. It's all about information. It's empowering them to make sure they get what they want. It is compassion not just for the patient, but compassion for the family and for the medical provider who doesn't have to guess. It's going to make a difference for people all across America.